Connective tissue is diverse, abundant, and widely distributed through the body. Its primary functions include structural support, binding structures together, fat storage, exchange of nutrients and metabolic waste, and defense and protection. All connective tissues share three basic components: cells, protein fibers, and ground substance. Together, the protein fibers and ground substance form the extracellular matrix. The proportions of these components, in addition to different cells and protein fibers, help define the various categories of connective tissue. In the adult, connective tissue can be divided into three broad categories: connective tissue proper, supporting connective tissue, and fluid connective tissue. There are two basic subcategories of connective tissue proper: loose connective tissue and dense connective tissue. Loose connective tissue has abundant ground substance with scattered cells and loosely arranged protein fibers. By comparison, dense connective tissue has abundant, tightly packed fibers, but relatively few cells and little ground substance. Loose connective tissue can be subdivided into areolar, adipose, and reticular connective tissue. Areolar connective tissue is found in the subcutaneous layer and around organs. It has a gel-like ground substance, numerous blood vessels, and scattered cells known as fibroblasts. Adipose connective tissue is found in subcutaneous tissue and around some organs. It is composed of closely packed adipocytes or fat cells. Reticular connective tissue forms the stroma, a connective tissue framework, of lymph nodes, the spleen, the thymus, and bone marrow. It is composed of a network of branched collagen fibers, known as reticular fibers, with scattered fibroblasts and leukocytes, or white blood cells, embedded in a gel-like ground substance. Dense connective tissue can be subdivided into dense regular, dense irregular, and elastic connective tissue. Dense regular connective tissue forms tendons and most ligaments. It is composed of densely packed parallel collagen fibers with fibroblasts between the layers. There is little ground substance. Dense irregular connective tissue is found in the dermis, periosteum and perichondrium, and the capsule of organs. This type of connective tissue is composed predominantly of randomly arranged collagen fibers with fibroblasts interspersed. There is more ground substance than found in dense regular connective tissue. Elastic tissue is found in the walls of elastic arteries, the trachea and bronchi, and the vocal cords. This type of connective tissue is composed predominantly of branching elastic fibers, with fibroblasts in some spaces between the fibers. Elastic fibers, formed by the protein elastin, stretch under tension and then return to their original shape when tension is released. Supporting connective tissue can be subdivided into cartilage and bone. Cartilage has a semi-solid extracellular matrix that allows flexibility, whereas the solid matrix of bone is more rigid and provides greater support. There are three types of cartilage: hyaline cartilage, elastic cartilage, and fibrocartilage. Hyaline cartilage is the most common type. It is found on the articular surfaces of synovial joints. It also forms the cartilage of the larynx, trachea, and nose. Chondrocytes, or mature cartilage cells, are found within small spaces called lacunae that are scattered irregularly in the extracellular matrix. Collagen fibrils are present within the matrix but not visible in the light microscope. A perichondrium, a dense irregular connective tissue sheath, overlies most cartilage. Elastic cartilage is found in the external ear and in the epiglottis. It contains abundant elastic fibers, which form a web-like mesh around lacunae that contain chondrocytes. Like hyaline cartilage, elastic cartilage usually has a perichondrium. Fibrocartilage is found in intervertebral discs, the pubic symphysis, and the menisci of the knee joint. It contains numerous irregular bundles of collagen fibers. The sparse ground substance contains chondrocytes within lacunae that are frequently arranged in parallel rows. Unlike hyaline and elastic cartilage, fibrocartilage does not have a perichondrium. There are two forms of bone or osseous connective tissue: compact bone and spongy bone. Compact bone usually forms the hard outer shell of bones. Concentric rings of bone, called lamellae, form cylindrical structures known as osteons. Each osteon has a central canal that connects to a network of tiny branching passageways called canaliculi. The central canal and canaliculi contain blood vessels. Osteocytes, or mature bone cells, occupy lacunae, small spaces, between neighboring lamellae. Spongy bone, also known as cancellous bone, usually forms inside of bones. It does not contain osteons. Slender bony plates, called trabeculae, form a bony network. The spaces between trabeculae contain bone marrow and blood vessels. Osteocytes are scattered throughout the trabeculae. The combination of compact and spongy bone allows bones to be both strong and lightweight. Fluid connective tissue is represented by blood. The formed elements of blood, specifically its cells and cell fragments, include erythrocytes, or red blood cells, leukocytes, or white blood cells, and platelets. The watery ground substance of blood contains dissolved protein fibers.